Did you know that vaginal discharge can tell you more about your health than any test? Many women over 50 consider it embarrassing, silently accept the changes, and ignore the signals sent by their bodies. However, there is a truth that is rarely discussed, even during gynecological examinations. The type of your discharge is a language your body uses to communicate with you. And if you learn to read it, you can detect inflammation, hormonal imbalances, and even more serious problems before they become chronic. Hello, I am Luca. Today I want to talk to you, not as a patient, but as a woman deserving of clarity, calmness, and truth. Together, let's discuss what is considered normal during and after menopause, the changes to watch out for, and why this conversation is about empowerment and awareness, not shame. The first misconception to dispel: after the age of 50, secretions should completely disappear. No, that is a mistaken belief. Certainly, estrogen levels decline and affect the mucous membranes. However, thin secretions, clear or slightly white, can continue even after menopause. This is a normal process related to vaginal cell regeneration and natural moisture levels. The real questions to consider are as follows. When discharges are yellow, green, foamy, foul-smelling, cheese-like, or accompanied by itching or burning pain, especially if they occur suddenly. All of these symptoms are like warning signals from the body. Please pay attention to me. When women feel that something is wrong, it is never a trivial matter. Our bodies are rarely wrong. In part 2, we will explain in detail how secretions change according to the stage of menopause, as well as the differences between normal ranges and abnormalities. Please stay with me. Let's learn together how to read the signs of your body. When women enter perimenopause, which can already occur after age 45, hormone levels begin to fluctuate. These changes do not happen suddenly, but progress slowly and subtly. One of the most sensitive indicators is the nature of the secretions. Why is that? Because the vaginal mucosa responds directly to estrogen levels. In the initial stage of menopause, you may notice a decrease in discharge, it becoming more watery, or it disappearing completely. This is not necessarily a warning sign, but rather reflects a decrease in hormonal activity. However, if you start to feel dryness, itching, pain during intercourse, or a mild burning sensation at that time, these are signs of so-called atrophic vaginitis. It is observed in almost 50% of women over 50, but almost no one talks about it. Women are embarrassed and endure it, thinking, it can't be helped, it's because of age. However, it is actually treatable. Gynecologists may suggest local hormone therapy, lubricating gels, or pelvic floor exercises. Please look. When estrogen levels decrease, the vaginal wall becomes thinner, blood flow worsens, and the natural lubrication production decreases. The mucous membrane becomes more sensitive to minor injuries, infections, and irritations. However, not all changes are related solely to hormones. Sometimes, abnormal secretions may be signs of bacterial vaginosis, candidiasis, or sexually transmitted infections, which can be activated by a decrease in local immunity during the mature phase. Therefore, the most important question is whether the discharge has disappeared or if its nature has not changed. Color, smell, and viscosity are like warning lights on the dashboard. Ignoring them is like driving with the oil lamp flashing. In the next section, we will discuss how to distinguish the 5 most common types of discharge and what each indicates about your health. White, yellowish, transparent, sticky, cheese-like discharges vary greatly. And these forms are not just things that happen. They are signs of what is happening inside. Let's look at them together without fear or embarrassment. Let's start with the most common, odorless, slightly whitish, transparent discharge that is a little sticky. This is a completely normal type. Even after menopause, especially if you are undergoing hormone therapy, such discharge can continue. These help with natural vaginal cleansing, maintaining the microbiome, and protecting against irritation. The following type is milky white and cheese-like. If you experience itching, a burning sensation, or dryness, it is probably candidiasis, also known as yeast infection. Yes, it can be seen not only in young people, but also in older adults. After age 50, especially when the immune system is weakened or when taking antibiotics, candidiasis occurs quite frequently. It is now grayish-white and has an unpleasant fish-like odor. This is almost always a sign of bacterial vaginitis. It is often mistaken for a yeast infection, but it is a completely different condition and requires different medication. Type 4. Yellow or green foamy discharge, often accompanied by irritation or swelling. This may indicate a sexually transmitted infection, such as trichomoniasis. Even if you haven't had sexual activity for a long time, do not dismiss this possibility. The infection can remain hidden in the body for years and may become active due to hormonal changes. In such moments, it is important not to panic and simply consult a doctor. Diagnosis is painless, and treatment is often simple and quick. Finally, bloody or blood-tinged discharge in postmenopausal women is a reason to see a gynecologist immediately, even if it is just a few drops. This may be the result of mucosal atrophy or a sign of a more serious condition, including cancer. Your body does not leak secrets nor cause fear. I warn you, in the next section, I will discuss the nature of secretions, how your microflora is related to them, and how to strengthen them even after the age of 60. The vaginal microflora is like a shield of self-defense for the body. It is mainly composed of lactic acid bacteria, creating an acidic environment that prevents the invasion of pathogenic microorganisms. However, with age, especially after menopause, this shield can weaken. Why is that? A decrease in estrogen levels directly affects the amount of glycogen in the mucous membrane, which nourishes the lactic acid bacteria. When glycogen decreases, the beneficial bacteria also decline, making the environment more alkaline. As a result, even without external causes, the risk of fungal and bacterial infections increases. Therefore, the same woman who previously had no issues with discharges begins to experience recurrent inflammation after the age of 55. It's not because you're doing something wrong, it's because the balance of your microbiota has changed. The good news is that you can maintain that balance. How? There are some simple and scientifically backed methods. First of all, these are intimate gels containing lactic acid. They help restore the natural acidity of the mucous membranes. They are especially effective when not undergoing hormone therapy. Next, intravaginal probiotics, capsules or suppositories containing live lactobacillus. They help establish the proper bacteria in the vagina after antibiotic use or during recurrent candidiasis. Let's take a look at what a healthy microbiome looks like. A dense layer of lactic acid bacteria covers the wall, preventing the intrusion of foreign microorganisms. This layer can be strengthened by creating appropriate conditions. Also, don't forget about your diet. Fermented foods, kefir, yogurt, sauerkraut, affect the overall microbiome of the body, especially the vagina. On the other hand, sugar promotes fungal growth and disrupts balance. In the next section, we will explain how hormonal changes after age 50 affect secretion and how they can be gently compensated using doctors or natural therapies. When women enter menopause, the estrogen levels in their bodies drop sharply. Most people associate this with hot flashes, sleep disturbances, and mood swings, but very few understand how much this impacts sexual health, particularly secretion. Estrogen is not just a female hormone. It plays an important role in maintaining the health of vaginal mucosa. It promotes blood flow, maintains tissue elasticity, helps produce mucus, and supports the microbiota. When its levels decrease, the mucosa becomes thinner, dry, and more susceptible to microdamage. How are the results? There may be a decrease in discharge, it may become watery, and tiny wounds may appear. Burning pain or light bleeding can also occur after intercourse. This is not an infection or mere aging. It is a result of hormone deficiency and is treatable. There are two main methods: support through hormone therapy and natural remedies. Local hormone therapy. Local hormone therapy involves creams, vaginal balls, or rings containing low doses of estrogen. These act locally and are absorbed minimally into the bloodstream, making them safe even for women for whom systemic therapy is contraindicated. Such formulations help regenerate mucous membranes, improve secretions, reduce dryness, and lower the risk of infection. However, if you do not want or cannot use hormones, There are alternatives. Excerpts from sage, soy, and flaxseed contain phytoestrogens, which are plant-based substances that mimic the action of estrogen in the body. Their effects are mild, but regular use can help alleviate deficiency symptoms. Also, do not forget exercise. Exercise improves blood circulation in the pelvis, which in turn enhances the nutritional status of the mucous membranes. Simple walks, Kegel exercises, and breathing techniques also provide practical benefits. Ligai no tameni jungyo na koto. Changes in secretions are not merely symptoms, but part of the entire hormonal system. Like pieces of a puzzle, if approached carefully and patiently with support, they can be assembled. In the next section, we will explain how secretions can be signs not only of age-related changes, but also of potential warning signs. We will also discuss what to do to recognize them properly. Sometimes, secretions are the first and only warning that something serious is happening in the body. This is especially important for women over 50, as many symptoms become less apparent than in younger years. The body may seem to have quieted down, but signals are still being sent. However, it is only quiet now. Let's look at when secretions might be signs of serious illness that cannot be ignored. Let's start with the most important: postmenopausal bleeding secretions. Even if your menstruation has stopped for more than a year, if you notice sudden light bleeding, there is always a reason to consult a doctor. It may be the result of dryness or microinjury, but it could also be a sign of polyps, endometrial thickening, or neoplastic disease. Only tests and ultrasound examinations are necessary to get an accurate answer. Visiting a gynecologist in such a situation is not fear, but strength. It is a choice for oneself. Additionally, as a warning sign, thick, foul-smelling foamy discharge may sometimes have a yellowish or greenish tint. This may indicate an infection, but it is not necessarily related to sexual activity. Sometimes, after the age of 50, the immune system weakens, and issues that were previously not a problem may suddenly start to surface. Women with uterine endometrial inserts and diabetes need to be especially careful. Their risk of infection is increased. The next concerning symptom is lower abdominal pain that appears with discharge. This may be a sign of cervicitis, endometritis, or cysts. However, the most important thing is not to attempt self-diagnosis. The internet cannot replace tests, ultrasounds, or examinations by experienced doctors. Even if you think it might heal naturally, it is better to confirm that everything is normal. You need confidence, not doubt. Your body always tells you when you need help. The only question is whether you can hear it. In the following section, I will explain why a slight unpleasant odor is not necessarily normal and how to distinguish between physiological scent and signs of inflammation. Many women over 50 begin to notice changes in the smell of their genital area, and in most cases, they feel embarrassed, awkward, and think it's just age, or that's just how it is. But the truth is this: barely perceptible light body odor is normal. On the other hand, a sharp, sour, rotten, or fishy smell is already a warning sign. The causes vary, and it is not always an infection. Sometimes it is just stress, taking antibiotics, or a disruption of the microbiota due to dietary changes. However, if the odor is accompanied by discharge, itching, redness, or a feeling of heaviness, it is no longer just physiology. One of the most common causes of such odors is bacterial vaginitis. This occurs when the beneficial bacteria, lactobacillus, are pushed out by other bacteria and do not become dominant. This is not a sexually transmitted infection, but it can also be caused by the use of strong intimate hygiene products. You might be surprised, but excessive hygiene can often cause imbalance. Hard soap, frequent washing, antibacterial agents. These are not only harmful, but also kill good bacteria. As a result, the pH balance is disrupted, leading to unpleasant odors. Acronym: normal vaginal pH level, between 3.8 and 4.5. This is an acidic environment. If it rises above this, for example above 5, bacteria begin to proliferate actively. What can be done? First, Avoid products with strong CG. Use gentle gels adjusted to a neutral or acidic pH. Next, watch your diet. Avoid excessive intake of sugar and quick carbohydrates. They feed yeast and bad bacteria. Third, if odor persists for a week or worsens, consult a doctor. There is no need to accept discomfort. Smell is not a judgment, just a sign. By approaching it with respect rather than anxiety, you can regain balance and confidence again. In the next section, I will explain how secretions and delicate health are related to the condition of the intestines, and why caring for digestion can help avoid inflammation. You might be surprised, but the health of the gut and the nature of vaginal secretions are closely related. Everything in your body is interconnected, especially when talking about the microbiome. The intestines, like the vagina, are home to billions of bacteria. And when the balance is disrupted there, it definitely affects this area as well. What happens when dysbiosis occurs in the gut? Pathogenic bacteria, which are conditional pathogens, become dominant, and their toxins enter the bloodstream, affecting the immune system, and can even alter the pH of the mucous membranes. Women often complain that after taking antibiotics or experiencing gastrointestinal issues, they notice discharges that were not present before. This is not a coincidence. Candida, bacterial vaginitis, unpleasant odor, itching. All of these may be the result of weak intestines, especially in cases of diets lacking dietary fiber and high in sugar, white bread, processed foods, and alcohol. Therefore, gynecologists are increasingly examining with a broader perspective, not only pelvic organs, but also including the digestive system. So, a step towards healthy discharge may start from the plate. What can be done? First, establish regular and soft bowel movements. Constipation is an enemy of the female microbiome. It causes stagnation around the pelvis and promotes inflammation. Next, increase the amount of dietary fiber. Vegetables, leafy greens, flaxseed, oatmeal, and blueberries nourish beneficial bacteria in the gut and vagina. Third, add probiotics. They do not need to be in supplement form. Natural sources include kefir, natural yogurt, and acetic acid bacteria. These are very effective. Fourth, reduce sugar intake. Candida fungi prefer sweet foods. The more sugar consumed, the higher the risk of itchy, foul-smelling discharge. Fifth, drink more water. Dehydration causes dryness and fragility of mucous membranes. In mature age, the body requires even more fluids to maintain protective functions. Sometimes, you don't need to start with hormones to improve intimate health. Sometimes, just restoring balance from within is enough. The body will take care of everything. In the next section, we will discuss the psychological and emotional relationship between stress and vaginal discharge and why anxious women tend to suffer from inflammation more frequently. One of the most underestimated reasons for changes in discharge is stress. Yes, it is precisely the emotional state. Women over 50 often experience a difficult transition period involving changes in family, health, and the body, and this is compounded by anxiety, insomnia, and increased sensitivity. All of these are often unnoticed, but most people are unaware that they affect not only mood, but also the vaginal microbiome. Constant tension keeps cortisol levels, the stress hormone, elevated. This suppresses immunity and interferes with the natural barrier of mucous membranes. What does it actually mean? The less protection there is, the higher the likelihood of bacteria and harmful bacteria multiplying. Therefore, in women who are worried and exhausted from overload, recurrent yeast infections and bacterial vaginosis often occur, along with strange discharges. You may notice, after a heavy week, fights, and lack of sleep, sudden itching or foul odor may appear. This is no coincidence. The body is reacting. Good news. The good news is that it can stabilize your mood. It is not necessarily pills. Simple daily habits are just as effective, if done regularly. First, breathing techniques. Deep diaphragmatic breathing lowers cortisol levels. Next, meditation or just 10 minutes of silence, without a mobile phone. The third is exercise. Yoga, swimming, walking. All of these ease internal tension. And finally, communication. When women speak, her body is breathing. Friends, sisters, therapists choose someone who can listen. Sometimes, even the habit of keeping a simple diary can serve as an anchor to bring you back to balance. Your delicate health is not just about bacteria, it is everything about you. Your emotions, thoughts, experiences, wounds, joys. And when you start caring for yourself, everything changes, even the nature of your secretions. Finally, we summarize. How to read your body's signals to maintain women's health, easily, calmly, confidently. Let's review everything we've discussed. Discharges are not something to be ashamed of. They are the natural language your body uses to communicate with you. If you can understand them, you will gain access to a very deep intuition of your body that medicine is beginning to reevaluate. We have seen that secretions change due to hormones, diet, microbiota, medication, emotional states, and even gut health. And all changes are not accidental. They are messages. They may be subtle, as slight changes in scent, or they can be significant, like itching, pain, or bleeding. That will never appear just like that. What is important? Don't panic, don't close your eyes, and don't procrastinate. Your health is not a talk for later. It is your resource, your energy, and your confidence. What can you do right now? Listen to your own voice. Ask questions. What has changed? What is my body trying to tell me? Consider whether stress, new medication, or diet might be affecting you. If you have any doubts, consult a doctor. It's better to check and feel reassured than to delay and worry. The most important thing is to stop feeling guilt or embarrassment within yourself. It is not weakness. It is compassion. It is maturity. There is no need to suffer in silence. You have the right to comfort, health, and confidence at any age. A compassionate approach to your secretions is not foolishness or whimsy. It is the wisdom of a mature body, speaking, I am with you. Listen to my voice. Look at yourself as you would look at someone close to you. Be prepared to understand with kindness and respect. You are strong, alive, and have the right to know what is happening to you and how to deal with it. I'm glad to have walked this path together. If you like this video, please subscribe to the channel and tell us in the comments what you plan to change starting today.